people have been struggling to manage being socially isolated, not being able to see family members, unfortunately perhaps losing family members and friends, having the financial insecurity.
I often think that mental health, particularly in ageing, is quite linked to sort of spirituality and identity, purpose, what matters in life. And what I've seen is, and I think generally as a whole country, but particularly in older people and people who've had COVID, those things that people rely on have almost been ripped from underneath them, and there's a real gap then of what's left and what matters in life and what's my purpose in life. If I've lost people that I love, if I've lost the ability to get up and do things I need to do, if I'm losing my thinking processes, what do I have in life?
I think there's been an increase in anxiety. Again, a lot of that is understandable given the circumstances that we've gone through and are still going through. So that is, I guess, worrying about the virus, catching it, knowing people that have been unwell, thinking about the measures, so adjusting to lockdown, but then also the other side of it in terms of coming out of lockdown and trying to return to whatever normal is for now. I guess it's also quite difficult, isn't it, about trying to adjust, because there's lots of messages around potential waves in the future and what that might mean. So the level of uncertainty that we're all living with is quite difficult.
However much they might resent it sometimes, at least what school does do is provide a really clear daily structure. And if you take that away, actually for some young people, the wheels really come off and mood can be massively impacted, purely because of the lack of all of the physical signals going back into the body saying a day is happening, life is carrying on, we can get on with this.
So there has been no doubt that we have had adults who have shared very difficult situations, and in those cases, we've sought really to link them back into support agencies and wellbeing hubs that are provided by their university, because there is help out there. But one of the things about being very depressed or feeling very anxious is that you lose touch with the resources around you that could actually help you.
We've all experienced stress, anxiety, worry over the last year, and young people are absolutely not immune to that, and I think also we have to bear in mind their different level of understanding and kind of comprehension of what's gone on. And whilst all young people are aware and they're actually often quite knowledgeable, they sometimes don't necessarily have the same ability to access information in the way that adults would, that help them to make sense of just how risky is this, or how dangerous is this, or what's my part in this. And some young people have found that really difficult to manage the messages of kind of how worried to be.
Themes that we did see coming up were for parents homeschooling their children, or just spending a lot more time with their children maybe than they're used to. Heightened parental anxieties around their child's learning, noticing things that they hadn't noticed before, becoming very concerned that their child was much further behind than they thought that they were. But that could sometimes be because the child was very far behind, but it could also be about parents. I mean, as a parent, you're not a teacher, you don't have a formal knowledge of child development, so sometimes it could just be about a parent's expectations about what a child age 7 or 8 should be able to do. So that was something I think that came up a lot for us in the practice, was many parents phoning up very anxious about their child's attainment.
I know that as restrictions are easing and people are going back into the gym and being more socially active, lots of my clients have been talking about worrying about body image and being around others again, and also I guess thinking about weight. One of the things I've been really aware of are lots of unhelpful posts on social media trying to advocate low calorie diets and realistic fitness plans. So I think this is a time to be compassionate and cut ourselves some slack for the journey that we've all been on.
Loneliness was already a huge problem before COVID, and actually now it's even more so, because those people who did have family support and support of neighbours and things, that's often gone as well. So even if people are helping practically, getting shopping, dropping it on the doorstep, they're not getting that social interaction and that emotional connection with real people. So that's had a big impact, and also a lot of the charitable voluntary sector things have had to shut down because of the restrictions. So there's been a lot less actual face-to-face support. Befriending services, day centres have had to close down. So that's the actual pandemic as a whole has had a real big impact on older people.
Some of what's happened over the last year might actually be really positive, in terms of there are some young people who have seen that they have agency and that they do have resilience and that they do have things that they can push forward. But it's definitely been a challenge.
One of the main things that is put forward by the government in those documents is around that relationship between the hospital and the community, and primary care, that communication between all the services and the importance of that, between people leaving hospital getting what they need once they're in the community, or being in the community and having the right care plan coming into hospital with them. I think that's definitely a really, really important area, which would be quite beneficial in our service if we did build on those relationships. It would give us more confidence that we were handing people over into the services that were there and people that knew them.
Within schools, they're talking about wanting to make sure that there are mental health workers in every school, and I think that's a brilliant plan, and I think that's really vital, and that's certainly something that I can then sort of dovetail into. So at the moment I work quite often consulting with teachers or support staff or school counsellors, and I guess the way I would see it is a bit of a sort of like a pyramid model, that essentially what we want is at the bottom of the pyramid for there to be really good resources available to everybody, to help everybody understand and manage their own well-being, whether that's physical or mental or both, hopefully, and then that for anyone who needs that little bit extra help, that there's slightly more targeted resources, that maybe that's where staff in schools or GP surgeries or things can come in.
I really want to try and take psychology out of the clinic setting and more so into the community. So thinking about how we can work with members of the community, thinking about working with religious leaders, thinking about working in a different way, and not necessarily having to focus on one-to-one therapy, but really thinking about other ways of incorporating psychological thinking and well-being into kind of our daily lives, trying to reduce the stigma that might be associated with mental health difficulties still in particular communities.
I'm excited for the idea that hopefully that the NHS long-term plan is looking much more at that sort of a pyramid model and of joining people up at those different levels.